Spiller is a clinical nutritionist with the Banyans Healthcare in Queensland, Australia. Her specific interests are in functional gastro-intestinal disorders, nutrition for mental health, and metabolic conditions, for example, metabolic syndrome and prediabetes. Tammy's work combines an understanding of how illness develops in the body and how this interacts with nutrition. Working with specialist testing results, pathology, current medications, and co-occurring health conditions, Tammy provides personalised, evidence-based nutrition plans for patients. She joins us today to talk us through how the right nutrition can make us more resilient to illness. Welcome to Pure Health Hub, Tammy.
Thanks for having me, Lindsay.
Pleasure. Now, we were talking about this a bit before, but now I was diagnosed in January 2020 with type 2 diabetes, and I've been living in chronic stress and anxiety for as long as I can remember. And I was physically and emotionally a train wreck. So I also underwent an hemithyroidectomy, having half my thyroid removed in August 2020 after the discovery of a 5-centimetre goiter. So two fairly significant sort of potential metabolic disorders. So I have more than a passing interest in our chat today. But I am also constantly hearing from women who are pre-diabetic. Now, this is a term that I'd never heard until I was diagnosed. But what does worry me is that some of these women can be quite blasé about their pre-diabetic diagnosis, and as if being on metformin has done them a favour by sort of helping them lose a little weight. But they don't seem to be grasping the seriousness of the potential of then stepping into a full type 2 diagnosis. I'm hoping we can discourage that a little today. So tell me, what are the most common metabolic disorders for women, and how much can they impact our long-term health?
Look, the kind of disorders that I see most of, as you say, are pre-diabetes, already diabetic in the early stages, and metabolic syndrome. And I think the numbers for metabolic syndrome are about 30% of the population. And I know we talked about this a little bit beforehand, but lots of people sort of, they get a high fasting blood glucose and the doctor just kind of says that's okay. And they might never develop diabetes, but what they do get is metabolic syndrome, because our bodies are actually really efficient in keeping our blood glucose in range. It's its main job. But all they test is this oral glucose test, that the 2-hour-long test that many women will have before they give birth. And instead of just checking glucose, they can actually check our insulin response then, which is, how are we handling this? How is our body? Are we insulin resistant already? And what's happening there? So I think that women aren't getting that is happening in the background. They just say my fasting blood glucose is high, but they're still, the doctor's happy with that range, even though at the high end. And they don't realize that that has flow-on effects for our liver, development of non-alcoholic fatty liver disease, vascular problems, slow to heal, slow to manage our weight. We're going to become lethargic, have difficulty with our, our cholesterol. There's a lot of problems that flow on from this. And, the end stages of that are higher mortality and cardiovascular disease. That's where diabetes ends up.
Oh, see, it's, it isn't simple. It isn't cut and dried. It has a spider web of potential danger, really. Okay, so are women then more susceptible? I mean, I'm obviously talking to women all the time, but are we more susceptible to metabolic disorders? And if so, why, do you think? And what age group is more vulnerable?
Well, I think, in young people, probably the risk factor or the susceptibility is the same across men and women. But as women age and go through childbirth and then into menopause, that risk increases, because a lot of how we manage our blood glucose and how responsive we are to insulin comes from our estrogen, how our hormones are tracking. And there's no greater time that we are at risk of those going awry than prior to pregnancy, after pregnancy, and in our menopausal years. Unfortunately, I am sort of seeing more of polycystic ovarian syndrome in younger people now, where their hormones and their kind of Western diet and lifestyle is impacting that. That's not all PCOS. There's different types of it, but there is an insulin resistant type as well.
Oh, I see. Okay, so that's also interlinked as well. So that
really
can be
is
as well. Excuse me. So then, are these disorders hereditary or lifestyle induced? And when I talk about lifestyle induced, I mean, obviously diet and exercise is a big part, but also things like stress and pain and chronic pain. So, you know, what is kind of the greatest risk factor here, or are they all combined?
It's a difficult thing to tease out, and the literature is not always clear on this, and there is a little bit of new evidence, and we're able to do DNA testing now, which is sort of looking at the genes that control the metabolism of different vitamins and minerals, and also our enzymes that let us know there are a few gene variations involved in the development of this. And, you know, sometimes you don't need that crystal ball. You just look to the family history, you know, in my case, a sister with gestational diabetes or a mother with metabolic syndrome. And in your case, there's probably near relatives with that. And so we don't need them. We don't need the DNA testing all the time to say, yes, there is a susceptibility. That's to type 2 diabetes and to MET-SIN, but obviously type 1 diabetes is an immune condition that has a large hereditary component. But, you know, if there's autoimmunity in your family, you know, with thyroid issues, or there's other people who have struggled to manage their weight, carbohydrates and insulin, then it's likely that you've probably got some of that as well.
Yeah, exactly. And of course, there has been, you know, there's now conflicting information about, you know, the best diet to have while you're a type 2, you know, as a type 2 diabetic. You know, carbs, no carbs, good carbs, you know, all of that. So I think that's the other challenge. Are you a zero carbs person, or are you a good carbs in limited advisor? I know that I'm putting you on the spot there, but
yeah, I don't mind answering this, but I'm not because I just deal with people day in and day out. I don't follow a diet as such. I'm so fortunate to work where as I said, I get these sort of DNA tests, or I do a gut microbiome test, and I look at people's blood work. Just their straight blood work, to be honest, tells us a lot about how they're handling things. I can sort of see from someone's electrolytes or how their kidney is functioning, and just I can get a real picture of exactly where their struggle is and then go to that spot. So I don't recommend zero carbs. Not that keto doesn't work sometimes. It was just that it was developed to manage epilepsy, really,
right.
and people had the side effect of losing weight. It's just that these are often not sustainable in our real everyday lives. So I like to work with what you like to eat and then modify it. Personally, lots of complex carbs. I don't really call them that. I think half a plate of veggies, and then limit the starch. The starch is where it's at. So, and probably like you, when you get into, I'm just 50 now, going through menopause, and my ability to manage that starch portion from a blood glucose perspective has changed dramatically. So you've got to do it over the lifetime as well. So you'd have had changes in the last 10 years probably.
Yeah, absolutely. There has been in all, you know, in most areas of our lives, really, and certainly for me. It's very interesting when you talk about that, and also fascinating that you can really drill down and almost diagnose something from these blood tests that we don't get if we go to our GP necessarily. Don't get me wrong, this is not about GP bashing at all. They do a very, very important job for us, and often under duress. So I don't want to do that, but clearly that, you know, they're limited by what they can do for us in terms of, you know, diagnosis and looking at taking it from a holistic perspective. But to know that we have got opportunities to get, you know, to drill right down on our bloods is fabulous.
Yeah, look, I don't want to, you know, my partner is medical, so I don't want to diss them, but they have a really short time frame to do a job. And I always say to clients, it's like you're a haystack, like they see the haystack and their job is to find the needles, and the specialists just see the needles. So that's what and so they don't have time to look at the patterns. Whereas when I get time with a client, I'm lucky to get, 45 minutes to an hour to go through their blood tests and say, I don't just have to look for disease. I can see the pattern of illness. Like, are these things raised or too low or not in an optimal range in the blood tests? Because we have a kind of a functional range we need them to be in, which is different to what's presented on the blood tests. And then we can see a pattern. Like, I can almost see a Western diet just in someone's regular blood work.
Yeah. See, isn't that, and that's a relief actually to know that that's possible and that it is available. Because, I think as we were talking about before, I've got a history of diabetes in the family, and then I had a sort of almost 12-pound baby. So I tested for years, every year for 20 years and more. He's 27 now. But at no point was I ever told that I was pre-diabetic or certainly not diabetic. And I hadn't heard of the term pre-diabetic. And it wasn't until an ambulance trip for an unrelated injury where he told me that my bloods were through the roof. So I guess what I'm trying to ask then is what are there signs that we can be looking for than just these sort of seem to be top-level blood tests that don't seem to get to the bottom of it? What can we be doing to own that a little bit more and be mindful of potential signs?
Well, the classic signs for diabetes as it progresses is thirst, frequent hunger, even when you've eaten, those kind of things. But in actual fact, well before that, people tend to wake with really poor energy. They might have a lot of inflammation, and so they'll have aching joints, usually some kind of pain somewhere in the body. They might feel frequently dehydrated. They can be, if that is also affecting their thyroid, then they can be constipated or have diarrhea, depending on which way it goes. So there are other things in there that are worth checking out, but also just checking the basics, like what is my TSH, which is your main thyroid hormone, and checking your iron, make sure it's okay, and checking your fasting blood glucose and your not cholesterol, but triglycerides and LDL. What are they doing? Because even if they start to be a little bit out of range, then that's the time to nip it in the bud. You don't need to wait until these get over range and you're diabetic.
So we really need to be asking, we need to be saying to ourselves, because, every one of those things you've said that we can all probably relate to on some level, but we've just got to stop ignoring those signs and saying, I've got kids and I'm tired, or I've got grandkids or I'm tired, and
or it's menopause. Because the biggest thing I see is people get to that stage and they say, I'm menopausal and this is just what's happening. And I'm like, well, you can still have low iron, you can still have a thyroid issue. They all look the same because the withdrawal of estrogen makes us insulin resistant. It brings those things on. We may have had disordered periods for a while beforehand. So menopause, thyroid disorders, autoimmune disorders, and pre-diabetes and metabolic syndrome, they all have very similar facets. So don't ignore them. And you know what? Women get a well woman check at 50 at the GP. They just don't know it. You just don't realize you actually get one of these checks. So go to them, have it checked out, and then start to look at other lifestyle things. Is my gut working? What's my stress like? How am I sleeping? And sleep, of course, is a big one as well, isn't it? So I think, all really good points, but I think we do tend to diss them a little more than we should. So then, all right. So then in isolation, diabetes, thyroid disorders, and I know that they're not just metabolic disorders, but they can be known as metabolic disorders. So then what is metabolic syndrome? Metabolic syndrome is, it's a cluster of symptoms that look like diabetes, but someone doesn't go on to develop diabetes. That's probably the best way to put it. So there are signs of metabolic syndrome. So you will probably have been tested for fasting blood glucose, and it'll be near the top of the range, but it probably won't be quite over. It will be what they call impaired. And so they probably won't progress you. And then your waist to hip ratio. So people tend to get bigger around the abdomen. And again, people associate this with menopause. And we have that menopausal shape because we're insulin resistant. We tend to develop a little around the middle. So that's a visceral fat, high blood pressure, and high triglyceride levels. And usually some hypertension will go with it. You don't need all of these symptoms to have metabolic syndrome. You just need 3 of them. But together, they characterize metabolic syndrome. And to be honest, like I told you, my mum has this, and she's never gone on to develop diabetes, but it's essentially functioning like a diabetic with this. And it's because we test glucose and we do not test insulin. It used to be standard. So you can have a high blood glucose, but your body is so clever at bringing it into range. But that doesn't mean that in the background, your insulin just continues to rise. Your body is pumping out insulin. You know, I call it knocking on the door of the cells to let the blood glucose go into the muscle and get out of the blood where it's doing damage. And instead of one knocking on the cell, you've got 20 of the suckers there going, knock, 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 let me in, and nothing is happening. Your blood glucose is staying high. And so because they're not testing for that insulin at the same time, a lot of this isn't picked up until you develop full-blown metabolic syndrome. And then it is hard to treat. They don't have anything for it. It is just lifestyle, nutrition, exercise.
Coming back to the 3 R's, really, for want of a better expression, it's got to come back to our lifestyle, and that is diet, and that is exercise, and it is stress, and it is managing stress, and all of those things, isn't it? So Absolutely. Tell me then, as I said to you before, I hadn't heard much about the Banyans, or I hadn't really heard of the Banyans here in Queensland before. And I'm a huge proponent for taking this holistic view of our health and taking time out if we need to. Can you give us a little bit of insight into the Banyans? So if someone, arrives and say with metabolic syndrome, and I'm sure this question could potentially have 1,000 different answers, but what could they expect when they get to the Banyans? Do they have to have all their bloods already done, or do they just arrive and then they're taken care of from there?
Yeah, they can reach out to us. So we have a beautiful intake team because we want to give people the right service. So our intake team will talk to them about what's going on for them and how we can design the best service. So we have day programs and residential programs. Our residential programs cover a range of things. So there are things like food addiction and eating disorders, mental health programs, dependency issues. And then there's also weight management kind of programs in there, and dealing with these kind of metabolic problems through our day program. So when you turn up to a day program, you get the full suite of testing. And we have what we call an interprofessional practice. So we work together on cases. So it's not just one practitioner. And the reason it developed is our lovely CEO, Ruth, had inquiries about how hard it was to find all of the individual practitioners and have them talking across, about your case. So you'll come in for the day, you'll have some breakfast there, and then you'll see a psychologist, a nutritionist or dietitian. You'll have exercise physiology, you'll do yoga, we'll learn about breath work and dealing with stress. And then you have a wellness coach, a lifestyle coach that talks to you. And that's across, if you do the day program, it's usually across 6 to 8 weeks, once a week for a full day. So it's intensive for you. And if it's at the residence, it's 2 to 4 week kind of programs where we come in, and that's a very intensive type therapy because you're in a different space there.
Well, and you've got to, rework, new habits into your life often, don't you? Sometimes we can become completely wayward in what we're doing, not even realizing it sometimes. But it was interesting that you talk about, it's like integrative medicine in a sense that you've got all the different specialists in their fields and they're talking to one another, which, I spent a lot of time in Asia with our cross-border health company, and that is exactly how they do things. You go into hospital for any reason at all and you need 3 different specialists. They're there talking all the time, every day.
Yeah.
You know, on your health. And you know, sadly, it just hasn't been the way that we do things here in Australia. And you know, to have clinics and facilities such as yours that does that is in my view the only way to really, you know, secure holistic health. What yeah, would you agree with that?
Absolutely. It's really hard. Like I tutored for a while in this space at UQ and interprofessional practice. And so we teach our clinicians coming through across the board about this. But when they get into the health system, it's really hard to deliver. And that's what drew me here, that it's very unique in its model. And they really try to bring it all together. Yeah,
I just can't think of a better way for you to be able to reach holistic health and, you know, everybody working in harmony to that goal. It sounds amazing. Really, the Banyans really is clearly a pioneer in this space here in Australia. You've taught us a lot about diabetes and thyroid and metabolic syndrome, and autoimmune obviously is a whole nother you know, the other side of this, and I'd love to chat to you about that one day. But thank you so much, Tammy, for your time today. I really appreciate it.
Thank you very much for having me, Lindy.